So I guess this is the old Sesame Street, which one of these is not like the other kind of talk. I think this is an important topic, and we weren't working with Dr. Stone's talk. We weren't sure where to put this in, so this seemed like a place in terms of us focusing more on earlier stage kind of prostate cancer and something that's relevant for all prostate cancer patients. So I wanted to go through, nutrition and prostate cancer, and I think there's a lot of misperceptions. I think a lot of patients will come in the door and I say, what are you doing to eat right? They're like, well, I've given up red meat. I'm doing everything right. And, and I'm not sure that's even the right answer, but I think a lot of patients want to do the right thing. I just don't think often the advice that we give them is the right advice. So I wanted to go through a little bit of kind of what we think we know and then what the data actually show in terms of what we do know. So we're going to define nutrition, type of a food, of amount of food, and we're going to play this game of what we think we know and what we actually know for all of these. We'll define the nature of the problem, we'll talk about excess amount of food, macronutrients, vegetables, and we'll kind of summarize. So nutrition is literally, and I think this is not from Wikipedia, but from some other enlightened source, I'm sure, the sum of the processes by which an animal or plant takes in and utilizes food substances. So if we do this right, we need macronutrient balance, we need to avoid harmful substance, we want to minimize calories and maximize how many calories we spend, which is physical activity. So that is the goal, and how we achieve it is highly debatable. So this is one of my favorite things they tell patients is the word diet literally means way of life. It is not a short-term intervention to look good for the summer in your bathing suit or your high school reunion or some wedding. It really is a way of life. And if we do this right, we will not only hopefully reduce prostate cancer or all cancer risk, aggressiveness, severity, but we're actually going to reduce heart disease. And of men diagnosed with prostate cancer, more of them actually die of heart disease than die of prostate cancer. So if a man's diagnosed with prostate cancer, you could say the biggest threat to his life is his heart, not his prostate. So we need to keep that in mind when we treat patients. And the diagnosis of cancer is a wake-up call. These men are highly motivated. We're actually been doing dietary trials, and I'm working with dietitians, and they will tell you the cancer patients they are working with are the most motivated patients they have, and across all the studies they work on. Cancer is a very scary time for these men, and I don't think we capitalize on that teachable moment. I remember reading a study once that 25% of patients stopped smoking simply because the doctor said, offhand, you should probably stop smoking. 1 in 4 actually did it. Now 75% don't, and there's a problem there, but a simple comment here or there can actually mean a lot, particularly for a newly diagnosed cancer patient when they're striving for this information. So at the end of the day, calories in minus calories out do equal net body weight change. So in terms of obesity and prostate cancer, what we think we know is that obese men are sicker. They're more likely to have heart disease, diabetes, kidney problems, and therefore, because they're sicker, we don't really have to worry about prostate cancer. And even if we were to think about prostate cancer, there's really no reason to link the two. What we actually know is that obese men are about 30% more likely to die, not get the disease, but die from prostate cancer. So these are two different studies here, one from the 1960s and one from the 80s and 90s. And so you heard from Dr. Stone in terms of PSA levels being lower in obese men. That's absolutely true. Back in the 1960s, we weren't using PSA to diagnose tumors. We weren't doing radical prostatectomies. And the results are the same. Being obese puts a man at greater risk of dying of prostate cancer. How about the amount of food? So what we think about in terms of, again, obesity and these things is prostate cancer is an older man's disease. And every textbook, every medical student who reads and goes through is taught there are 3 risk factors for prostate cancer. It's age, family history, and race. Every textbook, every article starts out, those are the three classic risk factors. And so therefore, the thought is, there's nothing we can do. Well, it's not necessarily true. So this is a study where basically we went to data from about 80,000 men from the American Cancer Society, followed for about 10 years, and then from 1992 onwards, we saw who got prostate cancer and how bad the cancer was. And if you looked at men who lost weight, the risk of all cancers was slightly lower than the other group, one being no change here to patients who are relatively weight stable. But particularly if you looked at the localized high grade, kind of that early stage bad cancers, those are the ones that we really want to capture because we think we can make a difference. Those are going to be the metastatic and fatal cancers. In this study, they actually reduced by over 40% by weight loss. Now, I don't know if it's necessarily 40. It's not a randomized trial. These were just people who happened to lose weight. But even the metastatic fatal was reduced by about 20%, suggesting maybe by losing weight, we can reduce our risk of bad prostate cancer. How about macronutrients? So what we think about dietary fat, and I can't tell you how many times I have heard this, is high-fat diets cause prostate cancer. And so cutting down fat will lower our prostate cancer risk. Now, mind you, this was the exact same information our government gave us back in the 1980s. They said high-fat diets cause obesity, you need to cut down your fat. And what did we as a country do? We listened. We actually listened. The amount of fat in the diet today is less than it was 30 years ago, dramatically less. And what's happened to obesity rates in 30 years? So is the government always right? Is age-old wisdom always right? So there are some early data to suggest dietary fat may be linked with prostate cancer. But a lot of them didn't really adjust for how obese the man was or how much food he ate or many other factors. So if we look at newer data, and here I picked out one study, 140,000 men, followed for 8 years, absolutely no association between overall fat and prostate cancer risk. Another study from the United States, 80,000 men, no association with dietary fat and prostate cancer risk. And a review published before those papers said studies are inconclusive on the role of fat with prostate cancer risk. Well, okay, maybe not all fat is bad, but you know that there's good fats and bad fats, right? We all know that. I mean, fish has fish oil, omega-3, and fish is good, so fish oil must be good. And saturated fat and on beef and all that stuff must be bad. I mean, okay, so it's not so simple fat is bad, but clearly we know this, right? Same, 140,000. They looked at those. No associations with any type of fat. 80,000. No association with any type of fat. In the study, they actually looked at meat and fat and saw nothing. So now, the thing is, this is where it gets actually, to me, kind of fun, but gets a little complex. So there are some data about the omega-3s, what we call quote-unquote fish oil, though we'll see in a minute, not all fish have the same amount of fish oil. And actually, grass-fed beef actually has a fair amount of omega-3. Nuts have it, other sources. Has been shown in some studies to reduce heart disease. And there is some data to suggest it reduces prostate cancer risk. There's actually some data that blood levels, if they are high, may increase prostate cancer risk. So even that's not a slam dunk that omega-3 equals good. But importantly, not all fish are alike. And what we think, notice I say think, because we don't know, what we think is important is the ratio of omega-6, which is your corn oil, your bad fats, quote unquote, to your omega-3s, which are your quote unquote good fats. So omega-6 is pro-inflammatory. It's arachidonic acid, breaks down into metabolites. And the ratio we think is important. We think humans evolved eating about a 1-to-1 ratio, maybe a 2-to-1 ratio. If we look at Japan, the Asian diet, where prostate cancer rates are much lower than they are in the U.S. It's about 4 to 1. In Western countries, it's as high as 10, sometimes maybe even 20 to 1. It's a lot more omega-6. But the interesting thing here is we look at how much bad fats, omega-6, is in different foods. Tilapia has 134 grams. Look at that. It has 30 times the amount of a donut, 4 times as much as a hamburger. And if you look at the ratio here, farm tilapia is 11 to 1. That's a Western diet. Farm catfish, 4 to 1. Farm salmon, and we know wild's going to be better. I've never seen wild tilapia. You do get wild salmon, less than 1 to 1. So salmon being pretty good. Catfish, so-so. Tilapia is not. And actually, the follow-up, what they read, if you read the text of this, to me this was fascinating. If you read the text, for individuals who are eating fish as a method to control inflammatory diseases, such as heart disease, it is clear from these numbers that tilapia is not a good choice. All other nutritional content aside, so again, forgetting the other nutritional content, sugar and everything else, the inflammatory potential of hamburgers and pork bacon is lower than the average serving of tilapia. Tilapia should be your dessert. That's your sweet, the bad thing that you eat at the end of the meal because you feel you need something a little bit more. That's what tilapia should be. So when patients come in and say, I've given up eating red meat, I'm eating nothing but fish, I'm doing right, doctor. Well, what kind of fish? Oh, I'm eating tilapia because that's what I like and it tastes great and it's cheap. They're actually harming themselves, we think. How about grain-fed beef? Omega-6 versus omega-3. Here, your standard steak you buy in the store is 4 to 1. It's actually not so bad. And if you're able to get grass-fed, you're down to 2 to 1. Remember, the Asian diet was 4 to 1. Lower, we think, is better. Grass-fed beef is better than the Asian diet. So patients giving up red meat, to eat tilapia, thinking, really wanting to do the right thing, because they've given up red meat and they're eating fish. And that's the problem, is when we give buzzwords to people. People come in. I was at literally last night, I was in Los Angeles at a patient support group. And a patient asked me, I was talking about diet, and he asked me, is a vegetarian diet good for prostate cancer? I said, it's a loaded question. Because to me, in my mind, what I jump to and worry about is Twinkies are a vegetarian diet. There is no meat in a Twinkie. That is a plant-based vegetarian diet, is a Twinkie. So if that's what he's eating, absolutely no, that's not good. If he's eating salad and he's eating fruit and kale and he's eating his broccoli, then it probably is good. So again, we need to get rid of these simple concepts of giving up red meat, I'm eating fish, I'm doing right. And really spend the time with the patients, understanding what they're actually doing. So in terms of fat, are there animal data that cutting out fat is good? And the answer, at least in animal data, is yes. And this is a study, they used corn oil. So again, omega-6 we think is on the bad side. Still, I would say a lot of this is controversial, but we think if there is a bad fat, it's going to be omega-6. And cutting out, going to low fat, feeding the same amount of food, significantly slowed tumor growth, again, in a mouse. What do we know about humans? And the short answer is we don't. So there was one study which gets a lot of talk and a lot of press, and it was 93 men on watchful waiting for, this is historical data published in 2005. So this is not active surveillance. This is more of a watchful waiting group. PSA is less than 10, Gleason less than 7. So you're low-risk patients. Randomized to a standard diet, which is basically keep doing what you're doing, or an intensive lifestyle intervention. So 10% dietary fat, extreme low fat. When we talk about low fat, American Heart Association recommends low fat, they recommend 30%. American diet's probably about 35 right now. You go back to the 70s, when actually our waistlines were half of what they are today, it's actually probably more like 40% of dietary fat. We're about 35, 34. This was 10%, very, very low. Vegan diet. They also had yoga. They had meditation. They actually took supplements. Vitamin E. Back in the day, we thought that was good. Look, it's a natural vitamin, must be good. So we ran the trial and found it increased prostate cancer risk. So they were throwing a lot of things at these patients. And they did show a slight decrease in the PSA levels in the experimental group and a slight increase in the standard group. Not a smoking gun, but that is some of the best data we have. So the problem is what you do is to avoid fat is people go eat low-fat foods. So I remember my daughter coming home from Halloween one year, and she had a pack of Skittles she'd gotten for Halloween. And big lettering on the front pack of the Skittles said, a fat-free food. Must be good for you. It's fat-free, right? What could go wrong with Skittles? I mean, so the problem is people went and bought low-fat ice cream. You bought low-fat desserts. And so sugar intake went through the roof. And what we've done is we've increased obesity rates. So what do we know about sugar in prostate cancer? Well, the traditional thinking is sugar is just a filler. Your body's going to burn it. And most of the research historically is focused on fats and proteins, and we didn't pay a whole lot of attention to sugar. So, but what we actually know is that particularly refined carbohydrates, simple sugars, lead to insulin spikes. And if you take prostate cancer cells in a petri dish and you throw on insulin, the cells grow faster. That's pretty clear cut, at least in a petri dish. We see this in animals as well when you give them insulin. The excess carbs we know lead to obesity. There was a very nice study that looked at 827 men who had prostate cancer, all physicians, may be relevant to people in the room here, and that they showed that the C-peptide levels, which is a measure of insulin levels, the higher it was, the more likely those men were to die of their cancer. So, what happens if we cut down on sugar? So, this is a study by some colleagues of ours where they cut out sugar in the diet and the tumors grew slower in mice. The challenge is, by cutting out sugar, they actually cut out a lot of the food. So these mice were actually skinnier. So we did a very similar study here where we didn't make the mice skinnier. We fed them the same amount of food. We just changed the type of food that they ate. And this is in terms of survival of the mouse. You can see if you're on a Western diet, well, that's bad. Low fat was better, and this was about a 12% vegan-esque amount of fat. And if you want to constrict, in this case, we want extreme low carb to the point of no carbohydrates. Something you can do in a mouse is a lot more challenging to do in a human, but you can get down to a couple percent carbohydrates. Very difficult, but doable. And it significantly prolongs survival. So again, that's in a mouse. What do we know in a human? We don't know. So we are actually conducting right now a phase 2 randomized trial of Atkins, which is a low carb. We're focusing on induction phase Atkins for 6 months, 20 grams of total carbohydrates per day. Carbohydrates are 4 calories per gram. That's 80 calories. Assuming they're probably eating about 1,500 calories. So we're talking about 5% of carbohydrates, calories. 95% are fat and protein. In men with a rising PSA, to see if we can slow the rate of PSA doubling time in men with recurrent disease after surgery or radiation. We're about 40 patients into the study. So how about micronutrients? What we think about tomatoes, well, tomatoes are good, right? I mean, lycopene, and it's a healthy food. That reduces prostate cancer risk, right? So this is the official FDA stance on it. Is the evidence found no credible evidence to support an association between lycopene and reduced risk of prostate, and very limited to support an association between tomato consumption and reduced risk of prostate cancer. And one interesting study, to me, it was interesting, is that found that tomato paste actually slowed prostate cancer growth, but lycopene did not. So I think, to me, as I think about it, as we try and get reductionist, and what is the one phytochemical, the one molecule in something as complex as an entire fruit or vegetable, depending on how we define tomato, I've heard both arguments, that you're not going to get the answer. You got to eat the whole food. And something actually very interesting about tomatoes as well is, assuming it is lycopene that we think is beneficial, is lycopene is fat soluble. Meaning if you eat a tomato like you would an apple just in the middle of the day, you actually aren't going to absorb any of the lycopene. Now if you add some buffalo mozzarella cheese and you add your olive oil and you make a very nice caprese salad, then you're going to absorb the lycopene. And it's actually the best data on tomatoes that are out there are not tomatoes, but tomato sauce. Now yes, tomato sauce often has sugar in it, which I don't think is a good thing, but where do you eat tomato sauce? You eat it on pizza, greasy pizza. You eat it with your meatballs and your pasta. You're having it with fat, and you actually get to absorb the nutrients. So again, it's not just thinking about the food. Vitamin D is another fat-soluble molecule. So when you have your skim milk fortified with vitamin D, you don't actually absorb any of it. So if you have patients who are trying to get their vitamin D levels up and they're eating a strict vegan diet, it's not going to happen. They're not going to absorb the vitamin D. So again, things that we start to think about reductions, I'm just going to take a pill and that's going to solve all my problems. There are no shortcuts. So in summary, if we do this right, if we can do this right, that we will have something that can reduce cancer risk, cancer severity, reduce the side effects, allow PSAs to be more accurate. We go down the list of different things that could be done. The problem is we don't know. And the minute we think we know, we're actually probably wrong. And that's where we need to start at the beginning and say we don't know. There's some things that seem to be perhaps accurate, but there's so much more we need to know. So how do we function in this world of uncertainty? What are some take-home messages? So this is what I try and live for myself, some days better than others, but what I try and tell my patients, which is you want to go low on calories and low on the carbohydrates, particularly simple carbohydrates. We could have a nice debate about complex carbs, whether they're good for you or just less bad for you. I'll leave it at that, not necessarily go where I think, but nonetheless, simple sugars clearly I think are part of the enemy. We want to go high on the exercise. There's a lot of data now, I don't know, a lot. There are certainly several papers now linking vigorous exercise with reduced prostate cancer risk and mortality. Not just general out for a leisurely stroll in the evening, but I tell patients if you can have a nice conversation while you're exercising, you're probably not doing it hard enough. You need to get your heart rate up, you need to get your breathing going, and for whatever for you is vigorous, that's how you define vigorous, as you can't talk through it. You do want to eat fruits and vegetables. The data are actually pretty poor to support fruits and vegetables as anti-cancer. I think they are beneficial when they replace something else. So instead of having the potato, if you have a salad instead, great. If you're going to have the potato and dessert and just adding a salad, probably not doing yourself a lot of benefits. Nuts, I think, again, are a good little snack. Particularly, a lot of patients do well during meals, but fall down at snack time. They get hungry, they eat the potato chips, they eat the candy bars. So nuts are a good snack, good healthy fats. Again, we think healthy. Legumes, which is your beans, your peanuts. I think meat is okay. We evolved as a species eating meat. But we evolved eating animals who ate their natural diets. So if you are going to eat meat, you want to keep them from animals eating their own natural things. Grass-fed beef, wild fish, free-range chicken, that type of thing. Probably the most important thing is to achieve and maintain a normal body weight. We heard about obesity on many levels here today. The adverse effects really is quite significant, and that is pretty uncontroversial in terms of its link with aggressive prostate cancer. And again, I think there is value in the adage that heart healthy is prostate healthy. And if I can leave with one adage, is that genes load the gun, but lifestyle pulls the trigger. Thank you for your attention.